So, hello, Sue. How are you?
I'm very well, Kevin. Thank you. How are you keeping?
Very good, thank you. So here we are today doing this video around your story, and it's a very interesting story, and there's a lot of detail to get through. And so I think let's just get to it. So if you'd like to kick off, I'll just turn my phone off so that it doesn't bother us.
Yeah, Kevin. It's a difficult thing to bring forward. But what I actually want to share with you today is what actually happened with my mum, who sadly actually passed away in 2018. And basically, what I want to share with yourself and your viewers is that death certificates are in fact lies. And not only are death certificates lies, but also from everything that, obviously I've gone through and what's been uncovered, diagnoses, you know. Basically what happened is my mum was told that she had lung cancer and aspergillosis. My mum was told she was dying of lung cancer in 2018 in June. This is long story short, and basically she had neither. She had none. When my mum passed away, I brought in the coroner because we didn't believe it, which I'll go over now from start to finish what actually happened, timeline of events. I brought in the coroner, refused to accept the cause of death, and they did a post-mortem, and lo and behold, my suspicions and my family's were actually correct, and my mum never had cancer or aspergillosis, although she was put palliative as both.
Can you just say a little bit about the history of her, really, in terms of
Yeah,
what
yeah,
what medically was wrong with her, and then what actually happened towards the end, and how she died?
yeah. In 2015, I took my mum to A&E because she was getting chest pain and she was a bit breathless. I took her to A&E not because I was direly concerned, but because she had chest pain, and I didn't want to mess about. So we went to A&E. They did a chest X-ray, came back and said, "Oh, Sandra, you've got a chest infection." Gave her antibiotics, and we came home. My mum took the antibiotics. She was absolutely fine. Within a couple of days after that, we was actually contacted by the hospital and told she would have to go back in. They'd seen something, the X-ray had shown something suspicious. She'd have to go back in. She'd have to have a CT scan. She went back. She had a CT scan. Then they said, well, following the CT scan, there's something on the scan. It's not quite right. We need to do a biopsy. Now, this is 2015. They did the biopsy. She agreed. She had the biopsy done. It was, I'm going to use the word bodged. It caused her to have a collapsed lung, and she also suffered with extensive pulmonary hemorrhage. Now, following that biopsy, she wasn't right anyway. She had obviously quite a lot of pain. 4 weeks, if that, after having that biopsy, we was actually back in hospital with her, where she was struggling with the throat and a balance. Within 24 hours of being in hospital, she developed palsy. They then put a nil by mouth and gave her an MB tube, no foods at all. Basically said she was aspirating and that it wouldn't be safe for her to eat. Later it came out in the medical notes that's not the case actually. The medical notes showed no signs of aspiration with any consistency when they did a video swallow, but that's later on. She was transferred to a different hospital. She was transferred to Salford, where they redid the swallow test. Now, bearing in mind, she'd done quite a while without eating or drinking. They put an MB tube up, so it was almost like she lost interest in food and drink after that. They redid that test and said, no, Sandra can eat, Sandra can drink. So we did that. In the meantime, we were waiting for the biopsy. And when I look back at my mum's notes now, what's interesting is at that point, my mum's biopsy hadn't come back, and it had shown, actually, when it did come back at that point, it had shown no cancer. In fact, the original biopsy just shows inflammation and fibrosis. But when I look at my mum's medical records, it actually says that known lung cancer. She hadn't been diagnosed with any lung cancer at that point. There was no lung cancer diagnosis with my mum at all at that point in 2015. So she was discharged from the Salford because she righted herself. The palsy disappeared. Following that, she didn't really eat. She didn't eat well. 2016, we were referred to the Wythenshawe. The consultant at Wigan, which is the Royal Albert Edward, which is where my mum's respiratory consultant was, he actually referred her on. We went to the Wythenshawe because the consultant at Wigan had said, it's not cancer, we don't think it's cancer, biopsy is inconclusive, however, I'm not prepared to leave it alone. He wouldn't leave it alone. He wouldn't wait, he wouldn't see, he would not leave it alone. So he referred her on. And they all came to this conclusion, yes, actually, it is cancer. The original biopsy, it isn't just fibrosis, it is cancer. Initially, they actually wanted to remove half of my mum's lung. And she said, no, I'll have radio. So in 2016, what happened was she was referred to the Wythenshawe. They said, oh, actually, that biopsy, that result you've got, no, that's wrong. Actually, it is cancer. And we'll put you through for radiotherapy. She
so
went
was
through.
So that the Wythenshawe that said that she had cancer?
Well, yeah, the consultant at Wigan wouldn't leave it alone. It was almost like she only ever had one biopsy, and that one biopsy always just said fibrosis and inflammation. But this consultant at Wigan wouldn't leave it alone. So, and he writes a letter stating that. So we went to the Wythenshawe, and they said, oh no, it's definitely cancer. That biopsy you've got, completely wrong. It's cancer. So they wanted to take half her lung away, which no, she didn't do. Which I couldn't understand that, because my mum had also been diagnosed with alleged severe COPD. So she refused that. So she went through the radiotherapy, and everything was fine. She went through it. Again, she was in a lot of pain, Kevin, because she'd had a bodged biopsy, which it was bodged. She'd had radiotherapy, so she kept getting pain on the left side. Now, that was in 2016. In 2017, the consultant, the respiratory physician at Wigan Infirmary, who she was actually under, kept saying to us, oh, on radiology, cancer's coming back. It's coming back. It's really, really spreading. To the point where the Christie actually stepped in and actually said, this is not cancer progression. Will you please put this on this lady's medical records? This is not cancer progression. But again, he kept insisting, oh no, cancer's getting bigger. Then the consultant at Wigan brought in a new diagnosis of, oh, she's got a disease called aspergillosis. Now, aspergillosis, Kevin, is a fungal infection of the lung.
Yeah.
And there's only one place in the UK that deals with it. And that is, again, a different department, but the Wythenshawe. So we went to the Wythenshawe, where they sat, and they said, look, on the scans, it doesn't look the way it should for aspergillosis. We don't think it is. But, however, we will treat on a just-in-case basis, which is exactly what they did. They gave her 2 treatments on a just-in-case, one which made her quite ill, and the other she completed. So she had aspergillosis. In the meantime, this is 2017, this consultant is adamant, aspergillosis is eating away the lung and cancer is spreading. Neither was the case. So that's how pretty much 2017 went. in 2018, I noticed with my mum, now up to 2018, what they were saying that she actually had didn't medically to me make sense. Because this was a woman who allegedly had lung cancer, aspergillosis, that in the consultant's words at Wigan were eating away the lung, and allegedly severe COPD. She had oxygen saturation of 98 throughout. And as we got into 2018, there were things that I was starting to question. It didn't make sense. So from about May onwards.
So what things didn't make sense? Could you just go through what those were?
Well, yeah, he had a down as being in 2017, 2018. He had my mum down as having an aspergillosis, a fungal infection that was eating away at the lung, in his words, and severe COPD. And yet she had oxygen saturation of 98, and she just didn't clinically match what they were saying in a lot of. Do you understand?
I do. So you've got a dispute there between the consultants, one saying that she had cancer and one saying that she didn't have. Yet but she had radiotherapy for the cancer.
Yeah, which we don't believe she ever had. We don't believe she ever had cancer at all. And in 2018, May, she started getting infections. She did get quite a few infections, COPD. And what actually happened was, in June, she actually had a PET scan. Now, bearing in mind, when I went to get the medical records for this, it went missing off server. It just disappeared off server. So I had to hunt to get this scan. This consultant at Wigan actually admitted my mum to hospital in June 2018. She had a PET scan, yeah. From that PET scan that went missing from server, the doctor came onto the ward and said, "I'm sorry, Sandra, your cancer is back. Basically, you're dying. Your only hope is immunotherapy, and we will send that off to see."
And when that was offered, that immunotherapy, was she told anything about what the research showed in terms of prognosis, or?
He basically, this consultant at Wigan, when he told her she was dying of lung cancer in June, and that cancer was back, actually turned around and said, the scan shows cancer reoccurrence. That report does not say that, Kevin. I've got that report. Doesn't say that at all. In fact, it says it can't rule out disease progression, as in cancer, but Luke's infective changes. Could you basically do a sputum culture? He never did that. He never did any of that.
Okay.
And basically he said that her only hope would be immunotherapy. He contacted my mum's GP, requested that she immediately be put on the gold standard framework, a DNR. And
what is gold standard framework?
It's basically end of life, isn't it? It's like a palliative step. It's a palliative step to no further treatment, no further investigations. And can you
just say what the DNR is?
A DNR is a do not resuscitate, which means that if you die, there's no resuscitation. She was also put on a statement of intent. Both the DNR and the statement of intent were given on the grounds of lung cancer, aspergillosis, and frailty. Them were the only reasons that my mum was to be put on a statement of intent and a DNR. Lung cancer and aspergillosis. Long story short, she came out of hospital in June after being told she's dying of cancer, and the immunotherapy would be her only hope. In the meantime, the doctor at Wigan had told the GP, we want put on all these DNR, gold standard. Yes. A couple of weeks after, I actually rang a secretary And I actually, just to find out, you know, what's happening with the biopsy, what's happening with the immunotherapy for my mum. And it was a different secretary to what I normally deal with. And she actually said to me, your mum doesn't have cancer. And I said, what? And she said, I'm looking at an MDT meeting here, and it actually says, and I'll quote it, Sandra to be discharged from pulmonary oncology as there is no malignancy present. So at this point, I'm thinking, so I said, well, can you just confirm that? And she confirmed it. So then I started to ask questions. I put the phone down from the secretary and immediately rang the GP. I rang the GP and I said, look, I've had this information about my mum. Something's not quite right. So she tried to contact the consultant at Wigan. He weren't very forward, shall we say, in wanting to speak to them. In the meantime, however, because my mum was on a statement of intent, which means that if my mum would have died at home, because she lived with me, if my mum would have died at home, there would be no need for police because her death would have been expected due to cancer. The GP immediately removed my mum from a statement of intent. She completely removed the statement of intent.
And why did she do that?
Because in all honesty, they didn't want to put the name to the death certificate. If my mum would have died at home, I don't think they wanted to take responsibility for a death certificate saying lung cancer, when in fact they would have known full well I'm going to contest it with the information that had just been given to me. So the statement of intent was removed. The DNR, the actual DNR, stayed in place. The do not resuscitate stayed in place.
Statement of intent, could you just explain to people what that is?
Right, okay, when somebody's approaching last stages of life, so to speak, and when somebody's, you know, terminally ill and there's nothing more that really can be done for them, and let's basically, long story short, it means that death is expected. If this person is to die, then it's not a shock. There's no suspicious circumstances at all, and it's expected. If my mum would have died without a statement of intent, the police could have been brought in, but because the statement of intent was put in place, which the GP removed, the minute I gave that information.
So that suggests that GP thought there's a lot more that could be done for your mother.
Well, I was actually questioning as well. I was also questioning the cancer diagnosis full stop. At that point now, I'm questioning everything. I'm questioning the severity of COPD, the aspergillosis, and the cancer. So it's almost like the GP actually went over the consultant's head and removed the statement of intent.
Okay. Now, Sue, could you just go back over then the circumstances after that led up to your mother's death, and to explain to listeners the last few moments?
What actually happened was we actually had a consultation in August with this consultant, which I recorded on my mobile phone, Kevin, because I didn't believe the word this man was saying. During this consultation, this was the last one, obviously. He actually lied about other consultants at different trusts. He lied about MDT meetings taking place that never existed. He got all the medications wrong. Now, bearing in mind, he's got my mum's PET scan from June in front of him here, and he's got her medical records there. He got all the medications wrong. He said, this was the final icing on the cake for me. My mum's cancer originally had always been said at the top of the lobe, and aspergillosis, according to him, was at the bottom. In this consultation in August, cancer had suddenly gone down to the bottom, and aspergillosis had gone to the top. So he got pretty much everything wrong, which I won't go into in detail here because it's just a lot. So we had this consultation. He told my mum in that consultation that actually cancer wasn't killing her, aspergillosis was killing her, was his words.
So why have given her the radiotherapy? I don't understand.
Exactly. He actually said to her in August of 2018, a month before she died, that, oh, Sandra, cancer's there. It's grown, but not much. I have this on an audio recording because I recorded it. That has responded to radiotherapy, which made me question, well, if that's responded to radiotherapy, why is my mum palliative care for lung cancer, as he'd done in June?
Doesn't make sense, does it?
No, none at all, Kevin, not at all. So he told her that aspergillosis was eating away the lung and that basically it was killing her. And if we didn't treat it, she would be dead in 6 months.
So just to then move on to the last admission and what happened and your concern.
Yeah, in September, in fact, my mum was actually okay. A family member had recently done the Wigan 10K race. That was on the Sunday. My mum was there, videos. She was fine. She wasn't actively dying. She was fine. And then on the Monday, she started to cough up a bit of blood. Now, I don't mess around with things like that, Kevin, you know. So I got her into hospital as soon as I could. I took her to Wigan. Well, I say we got her there as soon as we could. We actually rung an ambulance, and it took the ambulance 2 hours to come because she was a DNR. So when we did get to the hospital, A&E at the time, actually, I don't think they knew what was wrong with her. First of all, they said, oh, it's an infection. They never said it was cancer. Originally, they said it was a collapsed lung. They said that my mum, we think she's got a collapsed lung. So they gave her blood thinners, pain relief, and then she was taken up to the ward. She was fine. She was chatting away. This doctor came, and you know, we were making plans for her to come home. And then they wanted to do a CT scan for my mum. So we went out and had some fresh air. She was fine. She was chatting away. She'd had some fresh air. We went in to have a CT scan, but she couldn't lie flat because she felt sick. So we came back to the ward. This is the last admission. We came back to the ward, and she said, I can't go through with it. I don't feel very well. I feel sick. So they gave her anti-nausea tablets. So we went back down. We did the CT scan. She came back up from that CT scan, and she was chatting, and she said, I just feel really anxious, Susan. I feel really anxious. And so they gave her lorazepam. And within 30 minutes, 35, 40 maximum, my mum just said to me, I can't breathe. And that was the beginning of the end. She was gone within a day and a half later.
Did they only give her the lorazepam, or did they give her anything else?
Well, no. What actually happened was they gave her the lorazepam, but she'd been on quite a bit of oxygen before that. And they gave her the lorazepam, but she'd also had diamorphine for the pain in the rib area, which she'd had for years because of the biopsy and the radiotherapy. She'd had diamorphine. They'd given, at one point, a consultant said that her lung were bleeding, so she'd been on tranexamic acid. Then they gave her an injection to stop blood clots. The blood thinners, blood thickers. She'd had actually quite a cocktail and an anti-sickness. And then following that, she just couldn't breathe, and they came, and we was taken into a room, and I was told that my mum was basically dying, and to put a syringe driver on. And I actually said no. I said no. There was no any treatment at all. There was no antibiotics. So she had fluid up. They stopped everything. They just wanted to put her on a syringe driver. I said no. I wanted to give her a fighting chance because something wasn't right. She was perfectly fine before the lorazepam. And then the next thing, she couldn't breathe. So again, I was constantly questioning what was going on here.
So can I just ask you a question there? So she's having difficulty breathing, and was she on oxygen?
Yeah, they put her on oxygen, and actually a family member actually said, they just banged her on it, said, what's her blood gases? And they hadn't even done blood gases.
Okay. And
So
do you know what percentage oxygen she was on?
I don't at the minute, no. No, I've
And
not.
what was do you know the litres per minute she was on, or?
I think she was on 2 litres.
And then she had diamorphine through a pump on top of that.
What I have found since her passing, sadly, is that when I refused the syringe driver on the 13th. It is medically documented. It's documented. Yeah, it states family refuse syringe driver. Yeah. What concerns me, Kevin, is on the 12th, that very consultant at Wigan actually instructed that my mum be given via wine or IV, diamorphine and midazolam. So not only did she have the lorazepam and everything else, she'd also been given midazolam and diamorphine.
Mm-hmm. Did you know about that at the time? No. And you'd asked not for that. You'd asked that not be given.
Well, I was only asked about the syringe driver and everything on the 13th, and it clearly states in the records, family requested not to commence syringe driver.
So instead of a syringe driver, they did what they want, but they did it through another route.
Clearly, yeah.
Mm-hmm.
Clearly.
Okay.
So my mum passed away within a day. Within a day. And when it came to register her death, I refused to accept the death certificate. And what was uncovered changed my opinion of the medical profession 100%, Kevin.
So do you want to talk a little bit about that? How did you do that with the death certificate?
Well, what happened was I rang up to go and make an arrangement to go and register the death. And I just said, you know, what's my mum died of? And they said, lung cancer, aspergillosis, and right down at the bottom, COPD. And I immediately, without thinking, just said, no. And she said, are you refusing to accept the death certificate? I said, I'm refusing that, and I'm refusing to accept the cause of death. Didn't argue, put it through to the coroner. The coroner's office rang me and asked me why. And I said, there's information that I've been given. I don't believe my mum had cancer. I don't believe my mum had aspergillosis. The coroner agreed to do a post-mortem. The police coroner was then brought in. Yes. And we had to, it was quite traumatic, we had to formally go and identify my mum's body before a post-mortem could be done. So we did that, and we had a post-mortem, and there is the actual report from the post-mortem. I was 100% right, and a consultant in respiratory medicine was 100% wrong.
And that's at Wigan Hospital?
Yes.
Mm-hmm. Thank you. Yeah. So, Sue, that's an amazing story, and you're very brave to speak out about it, and you must have gone through a lot to get to this stage. So I really do say thank you very much for that.
The thing is, Kevin, is my mum isn't the only one. I don't believe my mum is the only one. And when I've actually got together sort of all my mum's medical records, there is a never-ending stream of lies, Kevin. You've got MDT meetings here. I'll just go through these dead briefly. It says on an MDT meeting, has cancer left and right side. That's not true. And then it went on to say, doesn't look like cancer. Then when I've got scan reports, you know, and the radiology, it says calcified gallstones, apparently she had. Mild stenosis of the liver, apparently she had. Apparently she also had renal failure. She never had any of those things in her life. The coroner's post-mortem also shows that. So there's a lot of things in my mum's medical record that do not match the coroner's post-mortem at all.
And so what did the coroner actually say then about the fact that the death certificate that they wanted to issue to you was basically a pack of lies?
Yeah, absolute lies. Basically, Kevin, my mum's cause of death was type 2 respiratory failure, bronchopneumonia. Bronchopneumonia, which may I add, can be quite treated with antibiotics. Antibiotics that she was never put on. They stopped everything the minute they put a syringe fibre in her.
And did the coroner say anything about the fact that the death certificate was a pack of lies?
Well, they actually put my mum's death down to a natural occurring death. Bronchopneumonia, type 2 respiratory failure. And I actually had an argument with the coroner because I believe, and I still believe to this day, this should have been an inquest. How can you tell a woman and put down lung cancer and aspergillosis as cause of death and not... Kevin, she didn't have a speckle of aspergillosis. She didn't have a single cancer cell in her body. You look at the death certificate, it's like looking at two completely different people. Even with the COPD, they said she was severe. The actual post-mortem shows my mum's COPD was actually mild to moderate. It wasn't severe. It was mild to moderate.
And do you think, I mean, you obviously have some suspicions here about what this was actually uncovering or covering up, because we're looking at one hospital and one particular practitioner here.
Yeah.
And do you want to talk a little bit about that?
I have a lot of concerns. I know that I am not the only person in Wigan with an issue with this particular consultant. After the post-mortem, obviously I put in a complaint and we went to a resolution meeting. Well, I call it a fob-off meeting, okay? At that fob-off meeting was nothing but lies, to the extent of what I'm going to share with you now. I'd requested that the other consultant that he'd mentioned that he'd also lied about at the Wythenshawe be present. In the resolution meeting, quite high up people from Wrightington, Wigan Lee NHS Foundation Trust were actually in that meeting. They actually claimed that the consultant at the Wythenshawe had declined to attend. He declined. When I had a meeting with him, he didn't even know about the meeting. He didn't know about the meeting. In fact, he'd had nothing to do with my mum's care for, was it 12 or 18 months? So that fact there showed that when this consultant from Wigan discussed my mum in August and mentioned his name, that was a lie.
So basically, these other people were excluded from that meeting, and they should have been there, or they should have known about it.
Yeah.
So again, that's coming back to a lack of integrity, isn't it? Yeah.
In fact, Kevin, the actual resolution meeting, the fob-off meeting, the consultant in question denied. He said, his words on the audio, he never told my mum she had cancer. He never put my mum palliative care lung cancer. He never spoke to the GP. Well, I have medical notes and all documentation, which I was producing. He basically denied all knowledge of it until I started putting medical records on the table. He admitted a catalogue of errors. The executives were more concerned about what I wanted, which was, I'd like you to, admit that there's been an epic mess up. It was put down to a miscommunication, which I argued and said, you know, you haven't told a woman she's got chickenpox when she's got shingles. Oh, it was just a miscommunication.
But how could it be a miscommunication? Because who signed the death certificate?
I don't know who signed it. I don't know who signed the death certificate, but it was put down that she died of lung cancer and chronic pulmonary aspergillosis.
So presumably that consultant signed that death certificate, or his team.
Yeah.
And then later on he turns around and says, well, she never had these things. But he treated
he denied.
He treated her for these things. He treated her for cancer, radiotherapy,
Yeah, he denied ever saying to me that my mum was dying of cancer. And I actually said to him, because it's all recorded, you actually admitted her. He denied speaking with the GP on the phone, but it's all documented in medical records. He denied everything.
So do you think then that this is, you know, they've got a bit of a problem person on their books and that they're covering things up? Or do you think...
Do you want me to be honest?
Yes, please.
Cards on table. I have justifiable evidence and concerns regarding this physician at Wigan Infirmary.
Yeah.
And I also feel quite strongly the fact that there's only so long you can go, keep blaming the consultant before you have to turn your attention to the management, because it is a fact. Things are being covered up, things are being brushed under the carpet, and if I had my way, Kevin, there would be quite a large investigation, and it wouldn't be just my mum who was looked into. I would want to know about this consultant's patients for the past 10 years if need be. Because I have concerns. With information that has come to me, yes, I have concerns.
Now, is there anything else you'd like to talk about in terms of the clinical? You talked about the scans, you've talked about the diagnosis, you've talked about the death certificate and your suspicions that led to you overturning the death certificate. That's a very important thing that you achieved there. Not many people do that. But as you said, there was no inquest. So just coming to the end now, is there anything else you'd like to say?
Yeah, I've got to say, I'm seeing a lot where people are questioning death certificates regarding COVID patients, and
because this is before the COVID era.
This is way before COVID, and the truth is, this is going on in hospitals, and everybody knows this goes on in hospitals. And I think it's time people started speaking out, because it's not just about my mum, Kevin. You know, people are dying. Yeah. They're dying, and some people are actually dying unnecessarily. And the deceased and also family members that are remaining, you know, have the right to peace of mind regarding causes of death. And without a post-mortem, in my eyes, because you look at, it's like looking at two completely different people. You look at the coroner's report, you look at my mum's medical records, and it's like, where have they been? Two completely different people. And what I will say is to people, if you have any doubt at all, don't just refuse the death certificate. Refuse the cause of death. Right. Refuse the initial cause of death. And speak out. Speak out, because what is happening is, no, it's not acceptable. It's not acceptable.
Thank you, Sue. Is there anything else you'd like to add?
No, I think that's about covered it. But what I would also like to add is, I did say to the trust, and I'll say this to you, I will be releasing everything. That means my mum's medical records, audio recordings, everything is going to be put into the public domain, because I care about people. I've not lost that touch for humanity like medicine has, and yeah.
Well, thank you very much, Sue, for your brave story and your brave actions, and for being a role model to other people at a time when, as you know, COVID death certificates are seen as a tissue of lies as well. Yeah. So it's very interesting for people to hear that what's been happening in the last 6 months with COVID has come on the back of what you've experienced. So it's really, there is a bedrock of bad practice in the health service there with death certificates.
Can I also say as well, at the resolution meeting, Kevin, and this is important, a family member who was in there with me, who is medical, actually said to them all, because they did admit a catalogue of errors. And she actually says, we will never know now. If Sandra hadn't have been given a syringe driver, we will never know if she would have lived. Now, they never turned around and said, oh, look, Sandra was dying anyway. They actually agreed and said, no, we'll never know. If she had never had the syringe driver, we would never know if she'd have lived. And
but you can imagine now what's happening in hospitals, because people are not allowed in. Their loved ones are there very often on their own. So they might have an hour a day with them, but they're excluded mainly. And that was in the days before COVID, and you had more access.
Yeah.
So it is quite.
And I find that odd. I find it odd because we've got this killer virus, Kevin. Yeah. That we've allegedly we've never seen before. It's never been seen with medicine before at all. They don't know. Sorry. They don't know what it is.
Well, I don't think they've seen it either, but anyway.
No, what I don't get is, you know as well as I do, science and medicine really does like to dabble and investigate and look at stuff. I mean, surely, TB and the Black Plague and even pneumonias, cures were found by opening people up. Cures were found by doing post-mortems. We've got this virus that is taking so many people. And yet, coroners aren't allowed to do post-mortems, but yet we've got a vaccine.
Yeah.
It doesn't make sense. That's my opinion. It doesn't make sense.
I think you're quite right. There's a lot of things that don't make sense at all about the COVID narrative. And there's a lot of questions that are being asked by many scientists about this. So,
and I would urge our government, the British government, in fact, and around the world, to authorise coroners to do post-mortems to find out why people are actually dying and how this virus actually works within the body. Because without a post-mortem, nobody's died of COVID, have they?
Well, the message people are often hearing is people have died after testing positive for COVID. And of course, that's not the same as dying as a result of COVID.
Exactly.
And as you know, in the Coronavirus Act, coroners are now not having juries, and there's a lot of anecdotal reports that there's no autopsies being done on bodies.
No, so, I have actually heard that. I have actually heard if you are COVID positive, the coroners are refusing to do post-mortems. And that's where, to me, that doesn't make sense, because as science and medicine go, you should be in there having a look at this virus that's never been seen to mankind before and finding out what it is actually doing to the human body. And the fact they're not doing that, but they have a vaccine, I find concerning.
I think you're quite right, and it's a valid concern. And you were very instrumental in overturning your mother's death certificate based on the evidence that you found and the behaviours that you witnessed, which were very suspicious. And many people now would find that very difficult to do what you achieved. So I'm sure that your story is very valuable for people to hear, and will give them lots of suggestions and lots of information to act for the future. What about legal challenge? Did you find any hope in doing that?
I don't want us to be careful when I say that here, but I'm not going to be careful, because I'll just say it as it is. Yeah, corruption rules, Kevin. Corruption rules, and if the medical profession, shall we say, mess up, and you live, they'll argue a bit about it, but then they'll go, yeah, okay, we'll admit liability. The medical profession mess up epically, and you die, and it really is a case of, oh well, they're dead. That's my experience. So if there's anybody out there that is legal who can tell me differently to that, then, you know, please get in touch. But that's...
Sure. Well, just finally then, Sue, for people listening to this and hearing this very worrying story, but a very important story, who maybe have loved ones or are themselves under the care of that particular hospital or that particular consultant in their team, what would you suggest they do if they had concerns?
I'll be very honest. The nursing staff at that trust, I have no issue with. The nursing staff, they're second to none. But they have no power. They have no control. Even if they have concerns or a complaint, they've no power. They've no control. For any family member, I mean, to be honest with you, if anybody was to contact me personally about it, I will happily reveal his name. I would demand a second opinion. If you've been told that you've got cancer, I would request that you know, retrieve your biopsy from the laboratory where it is, get a second opinion, get your medical notes, ask for everything, question the MDT meetings, because this consultant lied about MDT meetings. Kevin, MDT meetings are very important. And he lied about them.
That's the multidisciplinary team meeting.
Yes. Yeah. So I would question everything.
So question everything. Sorry?
If you have any doubt at all. You know what, Kevin? I have basic medical knowledge to compare to a consultant respiratory doctor, yeah? But my intuition just kept, you know your family member, you know your body. And I would say, if something doesn't feel right, doesn't sit right, question it. Speak out, because people are dying. Speak out.
Okay. Thank you very much, Sue.
No, thank you.
I think we'll leave it there, and we'll see how things proceed. Thank you very much. Bye-bye.
Thank you.